The most rewarding part about what I do is when patients come and see me and they're really scared and they're in tears or on the verge of tears, and by the end of their visit with me, they say, "I feel better. I'm not scared anymore." So breast cancer is very individualized. Not one person gets exactly the same treatment because not one person has the exact same cancer in the same location and the same biology. So we tailor it to what they have so that they can have the best outcome.
They were so patient and awesome, and they explain everything. There's nothing left to your imagination. You're not afraid. And I think the unknown is the most fearful. I don't know what I'm doing. I don't know. Just from day one, that makes a difference. When you feel supported, you feel like you're not on this journey alone. And I went for a normal yearly annual physical, and my doctor said, when's the last time you had a mammogram? I was quite quiet. I didn't want to admit I hadn't had one. And she said, "I need you to have one." I said, "But I don't know I need you to have one." I would tell women, don't neglect yourself. You are important too. Your yearly is important. Your yearly mammogram, your yearly physical is very important. It's the cornerstone of your health. It's the heart of the family. And as important as you are, you have to think of yourself as being important too, and take the time to go. Even if you just go for your yearly, you're more important than you think you are, and you can't neglect it because she found it so early. The treatment was easier than it would have been had it went on.
Hi, I'm Kevin Riley, the editor of the Atlanta Journal-Constitution. Welcome, everyone. We're coming to you today with the second installment of our AJC Aging in Atlanta virtual fall series. This season, we're focused on practicing wellness in all aspects of our lives and making the most of what we have. Today, we'll be talking about flu vaccines, chronic diseases, brain health, and accessing senior resources. Each panelist will make their own introduction, and then I'll have a conversation with each of them for approximately 10 minutes. Before we begin, I want to thank our sponsors who are graciously populating our panel of experts today: Kroger, Wellstar Health System, and Georgia Relay. And here are a few words from our presenting sponsor, Kroger.
Kroger is a proud sponsor of the Aging in Atlanta series, and as we head into the upcoming flu season, Kroger is as committed as ever to serving you and your family's health. No one should be left vulnerable to the flu, so don't take the risk. Get your free flu shot today at Kroger, where your health and safety is a priority. Visit Kroger.com/flu to schedule an appointment. That's Kroger.com/flu. Kroger, fresh for everyone.
Now, let's begin with introductions. First, Andrew Blake from Kroger.
Hey, Kevin. My name's Andrew Blake. I'm a recent pharmacy graduate from Mercer University College of Pharmacy. I'm a pharmacist with Kroger, and I've been at Kroger for about 20 years now. Happy to be here.
Good to have you. Next, Dr. Jeffrey Hines of Wellstar Health System.
Hi, Kevin. Thank you. Good afternoon, everyone. I'm Jeff Hines. I serve as Medical Director of Diversity, Inclusion, and Health Equity at Wellstar, and I'm also the Chief of Gynecologic Oncology. I'm a native New Yorker, did my medical degree at Brown University, and my fellowship in GYN Oncology at Georgetown. It's a pleasure to be here this afternoon. Thank you.
It's really great to have you. Next, Brendan Underwood of Georgia Relay.
Hey, Kevin. My name's Brendan Underwood, and I'm the outreach coordinator for a state program called Georgia Relay. We provide a variety of different phone services for speech and hearing difficulties, and I look forward to telling you guys more about that today.
Thank you. And finally, Dr. Kirk Bryant of Wellstar Medical Group.
Thanks, Kevin. It's good to be here. So, Dr. Kirk Bryant. So I'm a neuropsychologist at Wellstar, also director of the neuropsychology residency. And so I often see folks with concerns about some cognitive change or memory problems, and I do what I can to figure out how severe those problems are, where it's coming from, what's causing it, and what to do to help.
It's good to have you. Thanks for joining us. We're going to start with you, Andrew Blake. And let me start this way. The question of a flu vaccine. Hey, I feel great. I don't usually get the flu. Tell me why I should go get a flu shot.
Hey, Kevin, that's a great question. Let me start off by saying that on average, only less than half of Americans even get a flu shot every year. And this year is probably the most important year that we've seen in our generation to get one. It's important that everyone over the age of 6 months and older, they need to receive a flu vaccine, especially if you fall into a high-risk group of seniors that are age 65 and older. If you live in a nursing home or you're currently pregnant, or even young children or those that have chronic conditions such as asthma, diabetes, and heart disease. So receiving a flu vaccination has a lot more benefits than just that. It reduces the likelihood of getting the flu. And in some cases, if you were to become infected with the flu, it could decrease the duration of your symptoms. It can also reduce the number of days you'll miss from school or work. And most importantly, it'll keep you out of the hospital with a flu-related hospitalization or even death brought on from complications such as pneumonia. So each year, the flu is just a real significant burden to our healthcare system. And as we know, this year, it's already been very strained with COVID-19. So, receiving your flu vaccine, you're protecting those high-risk patients that I mentioned, that they haven't been able to get the flu vaccine, or they can't get out to their doctor or their pharmacy to receive one, or the children who are at the really high risk for developing complications from the flu as well. So even if you feel healthy and you say you've never had the flu, at least you're doing your part to help protect those who necessarily can't do it.
Thank you, Andrew. Now, how about this? When's the best time to go ahead and get that flu shot?
Honestly, Kevin, it's right now. So when you get a flu vaccine, it takes about 2 weeks for your body to develop a complete immune response to the vaccine you just received and provides you protection for it. So it's best to get that done before we start the flu season, really by Halloween, by the end of October. The early vaccinations that come out in October, I'm sorry, I misspoke. Vaccines that are first available in August, when you get that vaccine in August, you really only have 6 months of protection from a flu shot. So it may not get you to April when we really see the tail end of our flu season. And on top of that, children usually need 2 vaccine doses of the flu shot, given 4 weeks apart. So my recommendation is go ahead and get your appointment scheduled, talk to your doctor, go to the pharmacy, and get the flu shot now so that you're ready to roll by November.
Now, I know another thing a lot of people worry about or talk about is, will getting the flu shot give me the flu or make me sick?
I hear that question a lot. I actually had to talk to a patient today about that. The simple answer, Kevin, is no. The flu vaccine cannot give you the flu. There's a possibility that anyone who receives the vaccine can experience some side effects, such as soreness or redness or inflammation at the injection site. You can maybe experience some muscle aches or maybe a really low short duration fever. But this should not be misconstrued as having the flu. It's also possible during that 2-week window where your body's building up the antibodies from the vaccine that you may become infected with some other respiratory virus other than the flu, such as the one that causes the common cold. So it takes about 2 weeks for your body to really build up that immunity from the flu shot. And it may be possible to even catch the flu during this time, especially if you get vaccinated later in the season. But hopefully, because you've got these antibodies in your system, the symptoms will be much milder. And, worst case scenario with the flu shot, we see some sort of flu going around that we never anticipated seeing, a different variant or a different strain that wasn't included in this year's vaccine. But I will tell everyone, if you feel sick now, if you feel like you have a fever, if you're fighting off a cold right now, hold off until you feel better before you go to get a vaccine, because it's more likely that your immune system is already working to get you over this first illness, and then introducing this antigen may cause more symptoms of just feeling awful after the vaccine.
Now, you said this is a different year than almost ever before for a lot of us because of COVID. Will a flu vaccine help protect a person from COVID-19?
Well, I'm sure you all heard the term twindemic being thrown around the news recently. It's in reference to the flu season and COVID-19 occurring at the same time. When I look at the data that's coming from the Southern Hemisphere, because their seasons are opposite of ours. So we're looking at New Zealand, Australia, parts of South America, and Southern Africa. They didn't really see a lot of cases of co-infection going on with flu and COVID because of facial coverings, social distancing, good hand hygiene. Now, the flu virus and the coronavirus are two totally different viruses here. The symptoms present very much alike, but the flu vaccine itself is not going to protect you from COVID. There is a COVID vaccine currently in trial, and I hope that it'll be available to us in the very near future. But when it does come out, it's not going to be available to everyone. But the flu vaccine is available, it's plentiful, and you can go get it right now. Those COVID-19 symptoms, they look very similar to the flu, with your runny nose and fever and just general malaise. But it's also tough for your doctor to know which one you have. So if you've already told your doctor, I have these symptoms, but I did get my flu shot earlier, then at least your doctor can scratch that off and say, well, let's test you for COVID and treat it that way.
Okay, so I got a flu shot last year. Can I get away without having one this year?
No, you still need to go ahead and get one this year, and for two reasons. Each year, the virus changes, mutates, and adapts. And the experts that create these flu vaccines, they look at the most prevalent strains of the flu that affected the Southern Hemisphere, and they develop our flu vaccine based on what they saw to protect us from what we're most likely to see here. Now, second reason is that each year's vaccine is, you think of it like a booster shot. So the protection that you received from your flu shot last fall is only really effective for about 6 months. So it's important to get that booster shot every year with the new viral strains that are predicted to come around, because what we see this year may be totally different from what we saw last year anyway.
Okay, now you hear about high dose flu vaccine. Is that, are those, high dose and regular equally available? Is there a reason to get one or the other?
Yeah, that's a really good question. The high dose vaccine is a version of the vaccine that's only approved for use in adults older than 65 and up. And it contains about 4 times the amount of viral antigens than a standard vaccine. This is important because as you get older, you have less of an immune response to vaccines, and giving you a little bit more offers a little bit more protection. Now this season, all the flu vaccines that are available on the market cover 4 different strains of the flu, whereas in previous seasons, the high dose only covered 3. So unfortunately, due to some of the high demands for flu vaccines, which is a good thing, we've seen a shortage of the high dose vaccine across the country. But we've been told that we're going to expect to see some a little bit later this month. I have to note that the CDC and the ACIP have never really expressed a preference to one vaccine over the other. But I would stress it's important to get a vaccine. A flu shot is better than no flu shot. We've got plenty of the standard vaccine. And if you go visit your pharmacy or your doctor and they're out of the high dose, it's more important that you at least get vaccinated, especially before the season starts up.
Okay. Now, I'm going to, one more last question here. What else can a person do to avoid the flu and frankly, other illnesses as the colder weather sets in and the seasons change?
Yes, sir. My first recommendation, let's just keep doing the same thing that we've all been doing since March. Wash your hands regularly, wear a face covering or a mask. If you need to sneeze, make sure you're sneezing into the crook of your arm or into a tissue. Continue to socially distance yourselves, especially if you're out in public. And if you don't feel well, just stay home. call in sick that day. Let the kids take a sick day from school because it's not worth spreading it to someone else. And make sure you're telling your grandparents and your kids and your grandkids to make sure that they're doing the same. Second recommendation, go get your flu shot now. Tell your friends, tell your family to go get their flu shot. And then hopefully we'll all be protected by the end of this month once November rolls around and we really start seeing more cases of the flu.
Thank you. Thank you, Andrew.
Absolutely.
And thanks to Kroger, because we'll be randomly drawing 2 winners of a $50 Kroger gift card from those who registered for this event today. You'll be notified after the program if you're one of the winners. Now we have a message from Wellstar on the convenience of virtual care.
Visit a healthcare provider from anywhere with Wellstar Virtual Care. Our providers at Wellstar deliver expert primary care and specialty medicine to you in the convenience and comfort of your home. From routine checkups to chronic illnesses, you're just one call or click away from world-class care. Visit wellstar.org to set up your virtual visit. Wellstar, more than healthcare, people care.
All right, thank you. Now we're going to talk a little bit with Dr. Hines of Wellstar. Dr. Hines, let's start here. It's good to have you with us. What are the most common chronic diseases that affect people 55 and older? And why are seniors predominantly affected by these diseases?
Thank you again, Kevin, for the invitation. It's great to be here this afternoon. 55 and older hits home to me being 55 and older. So what are the illnesses that affect people like us? Illnesses like hypertension, diabetes, obesity, chronic lung disease, stress, cancer. These are some of the illnesses that affect older people, partly because of how we are genetically brought up and part of our environment. Let's look at the environment real quickly. We live in the diabetes belt here in the South. And so that's a big reason why when you look regionally in the United States, there are more cases of diabetes in this diabetes belt than perhaps there are in other parts of the country. Now, what do I mean by genetically? There are some of us that are just predispositioned to develop certain diseases, not because of the environment that we're in, but because that is just our disposition. For instance, no matter what your environment is, there are some people that are just going to develop hypertension. So these illnesses happen in people 55 and older, one, because you're older and it's more likely for these illnesses to become a problem. Number two, some of us will be genetically predisposed to certain illnesses. And number three, our environment plays a big role in how these diseases manifest themselves.
So among older people, who is most at risk and why? And then in your work at Wellstar, how do you try to address disparities among seniors and other people who are at risk?
Sure. One of the things about this COVID pandemic is it's really exposed a lot of us to have conversations around disparities. There are people who are more at risk for some of these chronic illnesses like hypertension, diabetes, cancer. And a lot of it is due to what we call the social determinants of health. Many of your listeners may have started to hear some more about the social determinants of health because this has all been unmasked by the COVID pandemic. And what they are, real briefly, the social determinants of health are the things that allow us to work, to be educated, to pray each day. And they include things like education status. They include things like employment. They include the neighborhood and environment. They include access to healthcare. But importantly, these social determinants of health are also determined by the distribution of resources that allow them to happen. And as many of us know, many of those resources are disproportionately allocated to certain communities. So who are some of the people at risk? Elderly people fall in a high risk category. Some of our residents that live in rural parts of the state are at high risk. Young people can be at high risk. People from lower socioeconomic statuses are at high risk. So it's not only these forces, but the resources that fund the ability for people to get access to healthcare, to get access to education. And so what WellStar is doing, and many organizations are doing, is how can you address the root cause? Can we make the environment more equitable for people? That is to say, can we encourage people to exercise more? How can we make the education system more equitable? Can we work with our public policy people to intervene to do things like that? So those are some of the things that WellStar is doing internally and externally to address the root cause of some of these inequities.
Now, here's a question we get from readers all the time during this pandemic. Is it safe to go in for routine appointments and screenings? I mean, what's your advice to people who are concerned about that?
Absolutely. It's very safe to go in. And I want to piggyback a little bit on what Andrew said as well, too. What we're seeing is that because people have had understandable fear from coronavirus, they have put off a lot of their routine care. And as a result, people are showing up to the office and to the hospital more sick. It's also important that we continue this routine care, and it's important that adults and children get their vaccines. So like Andrew said, it is so important for adults to come in and get their flu vaccines, if they're due for their shingles vaccine, if they're due for their pneumonia vaccines. And it's equally important for parents to bring their children in so they can get their routine well child care, get their vaccines. Hospitals, offices, especially offices, they are safe to return to. The ability to clean them and the precautions that all offices are taken to make sure that people are safe when they come in is there. So it's so critically important that people resume their normal health care and get their vaccines and get their children vaccinated.
Now, what are some of the signs and symptoms of most common diseases that people should look for, keep their eyes open for, notice?
Sure, that's a great question. Many signs and symptoms can be somewhat vague. And I think because they're vague, it really should drive people to their physician so that they can get evaluated. For instance, unexplained tiredness can be a common symptom that people will complain of when they have many chronic illnesses like hypertension or diabetes or certain cancers. If you stick with cancers just for a minute, one of the wonderful things about cancers is many of these cancers you can screen for. And so another reason why it's important to return to your physician's office is to go through the screening that you can do regularly to help make sure that you don't develop a disease. For instance, October is Breast Cancer Awareness Month, and many of us are really touting the importance of women getting their mammograms. Other symptoms of disease could include things like a chronic cough that you're not used to having. One of the common symptoms of diabetes could be weight gain or weight loss or frequent urination. So those symptoms that are not usual for you are ones that should make you concerned enough to make that call and take a visit to your physician's office.
So heart disease and cancer are leading causes of problems and disabilities for seniors. What can seniors do to stave them off, to prevent them?
Much of the way that seniors can do to stave these off really depends upon the environment that you are in and some of the choices that we make as well, too. For instance, stopping smoking is key to helping treat and prevent, for instance, hypertension, high blood pressure, heart disease, lung disease. So I always tell my patients, it's not fair for me to say stop smoking, but it's fair for me to say, please go get some help so that you can stop smoking. So smoking cessation is important. Regularly scheduled exercise is critically important as well, too. As an oncologist, we define moderate activity as doing something inside or outside, some physical activity, 3 or 4 days a week for 30 to 45 minutes at a time. And I always tell my patients, and I would encourage your listeners to do the same, don't discount walking. It always concerns me when one of my patients say, well, Dr. Hines, I just walk. It's like, take the just out of it. Walking is critically important. What is important is to be disciplined about it. The advice that I would give your listeners is try to find someone to walk or to exercise with. It's easy for you to say, I'll just do it tomorrow since it's just me. But if someone is waiting for you to make that walk or to work out or to exercise, you're not going to leave them, behind. The other thing that we can all do is a healthy, balanced diet, eating healthy. And that's another thing. It's not fair for me to say lose weight, but it's fair for me to say, let's get some help and talk about how you can lose weight by a healthy, balanced diet. Other things that you can do to help treat disease is get your screenings done on a regularly scheduled basis. As a GYN oncologist, for me, that means for my patients to get their mammograms and their pap smears done regularly. It means for me to talk to my female patients to get their colonoscopies done regularly. And I tell them their significant others, their spouses that are with them, please get your colonoscopy or get your screening for prostate cancer done as well, too. So those are some of the meaningful things that we can do to help prevent and treat chronic illnesses.
Well, thank you, Dr. Hines, for all of that great and pragmatic advice. We're going to take a quick break here and then come back with yet another one of our expert panel.
Well, my family's been in real estate in Atlanta for over 100 years. So when I got out of college and came to Atlanta, real estate was kind of natural to me. Well, after our success in Park Springs, we were looking to our second project, and we came down and looked in Buckhead. It's really kind of the perfect location for a community here in the Buckhead market. Our intention at the Terraces Peach Trails Place is to use those same things we've learned at Pebblebrook, apply those. It's a different way, it's a different really model, and I'm excited about the opportunity to bring it here to Peach Trails Place.
Welcome back. And now some questions for Brendan Underwood of Georgia Relay. Brendan, I think we have an obvious place to start, which is tell us about Georgia Relay and what it does and how you help seniors.
Yes, thank you, Kevin. And as I said earlier, Georgia Relay is a state-funded program. We provide a variety of no-cost phone services for speech loss, hearing difficulties, and the combination of being both deaf and blind. And obviously, since March, you can imagine that our services have seen a spike, one of the largest spikes we've seen in use in our history. And so what it's doing with seniors is it's keeping them connected in a time where we're being asked to stay home and kind of isolate ourselves a little bit more than we have been in the past. This is allowing seniors to keep in touch with their families, their loved ones, their doctors. So that's a little bit about Georgia Relay. And as an outreach coordinator, it's been a unique time for me. Usually I travel the state looking for different events to attend, whether that's setting up a table or giving a presentation, which clearly we've had to all move to virtual stuff. So, it's been unique connecting with the users of our program right now, but it's something that we've definitely been dealing with the ups and downs of.
So, Brendan, I got this advice to ask you about captioned telephone and exactly what that is as one of your services.
Yeah, so caption telephone of all of our services, caption telephone is the one that is most frequently used. It's going to target our hard of hearing market. And specifically what's happening there is they have a phone that attached to it is a screen. And the screen will caption what the other party is saying. So they're going to hear what everything is being spoken, but in case they don't quite comprehend everything, they can read along the screen with them. These are wonderful pieces of device. They are also free through our program. So, you know, it's a kind of a no-brainer. If you're having difficulty hearing over the phone, we can get this equipment in your hands for no cost. And the service itself is also free. So in addition to that, I would like to mention a couple of the different features that the phone offers. One of our models has Bluetooth. So we're seeing hearing aids now that have Bluetooth connectivity. So now you could have that synced to your hearing aid. We also have a built-in answering machine, which is huge because it will caption what the message is. So oftentimes we receive feedback from users, oh, you know, I got a call from the doctor today, the doctor's office, but the front office woman was too fast, or you know, her pitch was just not right for me. And so this is a great tool that we have built in. And you know, the other thing I want to mention about the phone is that there are different models available. So, you know, whether it's, you know, we have ones that are reliant on internet. We also have ones that are just available with your phone line. And then we also have CapTel phone available through your computers or your touch screens and such.
Brendan, if I'm thinking about getting any of these services, what should I do to prepare?
That's a great question. So there's a couple different ways to get equipment from us. As it relates specifically to the caption telephone, there is a doctor verification form. So essentially, you're whether it's a regular doctor or a hearing healthcare professional, if you're a veteran and you want to go through the VA, they just simply have to verify that you have hearing loss, and then that makes you eligible for a free CapTel phone. In addition to that, if there's other equipment that you're seeking related to our services, we oftentimes tell you to get in touch with the state equipment distribution program. They're called the Georgia Center for Deaf and Hard of Hearing, and they have a very similar process in terms of getting equipment. And then there's always the option of outright buying the equipment as well. The caption telephone I went over is a one-time cost of $75. So there's 3 different options of how you can get those the equipment in your hands.
So I heard you call it CapTel phone as sort of your shorthand for using it, and you emphasize that it's free. But how complicated is it to install? I mean, if I want to get that, how long will it take?
That's a great question. So with the phone, it's really easy as long as you have a landline service already. It's kind of one of those where you can plug it in and you should be good to go. Obviously, we don't just want to give you a piece of equipment, though, and tell you, here it is, figure it out. So oftentimes what we're doing now is we're setting up virtual meetings and allowing people to kind of get a little bit more of the rundown on all the different features. Like I said, there's a lot of things that are customizable based on an individual's needs and what they prefer. And so we'll kind of just go through and kind of like dial in on the various settings. But yeah, as long as you have phone service and if you get an internet-based model, it should be very easy to put in, but we can also set up installations for you, and that's also at no cost.
Well, what about other services that are available through Georgia Relay?
Sure. Yeah, so we've talked about CapTel, which mostly is just specific to our hard of hearing market, but we have other services such as hearing carryover, voice carryover, TTY, and speech to speech. And these are going to be some of the other services that are more specific to either being deaf and blind or having difficulty speaking altogether. The one thing that I want the viewers and the readers to take away is that we have a variety of different services based on an individual's needs. So, you know, one thing not to forget is our website has a wonderful amount of resources. GeorgiaRelay.org I'm putting out at least 1 or 2 monthly webinars. So if you go to that website, you can literally right on the homepage, click on it, and it'll sign you up for our next one is actually coming up on the 22nd at 10:30 a.m.
Now, you mentioned the website as the best way to get more information and reach out, but is also a phone number available if people would prefer to contact you that way or by email or something?
Oh, yeah, sure. There's multiple ways to get in touch with me. 711 is what will connect you to Georgia Relay. So no matter what phone you have, if it's a landline or a cell phone in the state of Georgia, it'll connect you to Georgia Relay, and ultimately it'll get you to me. And then obviously you can email me, and I have a number as well. But I'm happy to be a resource. And, at the end of the day, what we want to do is we want people to be connected. We don't want them to continue to feel isolated. And the one thing that I hear most frequent as I travel the state, or at least prior to COVID was continuously traveling the state, is that there's so many people out there that don't know about our program. So I feel like we all know people that struggle using the phone. And, whether it's you individually or the fact that you know someone, I feel like we all can take this information and share it with someone. And again, just keep everyone connected.
Well, thanks so much, Brendan. And I do hope this serves to create more awareness of those services, which I think can really help people's quality of life and keep them connected. Next, we're going to discuss brain health with Dr. Bryant of WellStar. So, Dr. Bryant, let me first of all welcome and thanks for being here again.
Thanks for having me.
And let me start with this question: what are the most common brain diseases that affect older people, and who's most susceptible?
Sure. So I think the one that's most common is the one that we've all heard about. It gets a lot of publicity. So Alzheimer's disease. So that accounts for about 60 to 80% of all dementia cases. There's other conditions out there. So Parkinson's disease is a brain condition that affects a lot of motor functioning, but there's conditions that are closely related to Parkinson's, like dementia with Lewy body, where folks have the motor symptoms like Parkinson's, but they can also have dementias and cognitive involvements much earlier on in the process. And then finally, I think this is an important one, would be vascular dementia. So a lot of people think about vascular dementia like a big stroke or event that happens. But you can also have vascular dementia or mild cognitive impairment for cumulative effects of cardiovascular risk factors like hypertension, high cholesterol, diabetes, particularly if they're not well managed over time. So it's a pleasure to be part of this panel. I believe what I'm going to be talking about really parallels what Dr. Hines has mentioned earlier, because what affects the body is going to affect the brain. So a big risk factor would be age. With Alzheimer's disease, it's about 3% of folks age 65 to 75 have Alzheimer's disease, and that increases over time until you're at about 32% of folks that are 85 plus. There's some genetic component to having some sort of susceptibility to having these brain diseases, but it's not the whole picture. So a lot of folks worry about, okay, they're having some memory changes, they have some first degree relatives, like their parents had Alzheimer's, should I be really worried about it? It can increase your chance a little bit, but it doesn't mean that you're going to have it just because folks in your family had it. It's a little bit different story if you get Alzheimer's disease before 65. If there's a strong family history of that, then there's a different type of genetic component to that. But not necessarily with a later onset after 65. So we're only really touching on part of the picture here. Another big part of the picture would be these chronic health conditions like hypertension, diabetes, cholesterol, because they can independently cause these cumulative changes and cognitive dysfunction, but they can also put you at greater risk for diseases like Alzheimer's disease. So basically, if you're older and you're dealing with a lot of chronic health conditions, you're at greater risk.
So you talked about the need for those chronic health conditions to be, I think you said, well managed. be a little blunter about exactly what your advice would be to people with those kinds of conditions.
Yeah, sure. You got to follow with your doctors. Make sure you're having regular follow-ups with primary care and other specialists. Taking your medications as prescribed, and then staying active physically, cognitively, and making sure you're trying to do the right things behaviorally, like eating right, and not smoking, not drinking too much. Yeah.
What impact does a chronic disease have on brain function and overall brain health? And what are some of the cognitive changes that you would see related to those diseases?
Yeah, so the brain, it loves blood and oxygen, so it's the biggest consumer of those things in the body. So there's a bunch of tiny vessels deep down in the brain, and if you have chronic conditions like hypertension and diabetes that aren't well treated, you can get little dings in these pathways that those vessels are feeding, kind of like little potholes in the roadways. So it can make your thinking much less efficient, slow down the speed of thinking, more difficulty with multitasking, problem solving, following complex step-by-step instructions. So these changes can independently affect cognitive functioning, but also, like I said earlier, it puts you more at risk for having changes to the proteins in the brain that are associated with Alzheimer's disease and other neurodegenerative processes.
What are some of the signs and symptoms of these brain function issues, and at what point should someone, go to their doctor with concerns, as opposed to, I think sometimes we just feel like, hey, as we get older, maybe we're not as sharp as we used to be. But when do I go to the doctor and ask?
Yeah, unfortunately, you're right about aging. So processing speed starts to go downhill once you get in your 20s. So some degree of change is normal. But if you're getting kind of a consistent, kind of regular pattern of change over time, and it's outside of what you expect based on the folks around you, your peers, then you might want to go see a doctor. So what I mean about regular is we all have slip-ups. We all have memory problems. We might, leave our keys in the door or put something weird in the refrigerator, but it doesn't mean you have dementia. But if folks are, doing that consistently, daily, weekly, where they might be repeating themselves or having a lot of word finding trouble, they can't put that new information away into long-term storage, that could be a sign of Alzheimer's disease or another brain problem. We think about cognitive changes, but you can also have changes in, psychological symptoms, so spikes in depression or anxiety or visual hallucinations, because, like memory, that comes from the brain too. So if somebody doesn't have a history of those things earlier in life and they suddenly have a dramatic spike in depression or anxiety, that's kind of a sign for concern. And also motoric changes. If you have changes in your gait or tremor or a lot of dizziness or falls, that could be a sign of Parkinsonian kind of condition. Yeah.
Now, we talk about brain health. First, what exactly does that mean, and then how can a person pay attention to making sure that stuff, your brain stays healthy and functions well, and in particular, someone who might live alone? We got that question specifically.
Yeah, it's a good question. Fortunately, it's not all that complicated, because what's good for your body is going to be good for your brain. So all those things that Dr. Hines mentioned is going to be good for your brain. So following with your doctors, making sure that all your chronic conditions are treated well, you're taking your medications on time. Diet's important. So there's a lot of evidence out there for Mediterranean diet. So fruits, vegetables, chicken, fish, whole grains, trying to stay away from the saturated fats and kind of processed foods and sugars. So eating a healthy diet is often more important than taking a bunch of supplements. So it's better to get your omega-3 fatty acids from eating a nice piece of fish than just popping a bunch of pills. Regular exercise is key. And like Dr. Hines mentioned, you don't have to go out there and, run a marathon once a month. Just get out there and get some regular walking in or physical activity, something that works for you and that's sustainable. Same thing with cognitive activity. So you want to try to keep your brain engaged. Not a lot of good evidence for any particular kind of computer programs or puzzles, so you don't have to spend all your money on that kind of stuff. But find something you enjoy doing. It might be gardening, reading, playing cards with folks, talking about movies with people. Those things are important. And that kind of leads to that last component of the question there with the reader question and comment. Social activity is really important, and that can be more difficult for older folks to maintain, particularly if you're living alone. So it'd be really important to try to be really mindful and intentional about adding social contact into the schedule that you have, whether it be meeting somebody for lunch. These days it might be, calling somebody up, putting them on speaker while you're eating a meal together. You can talk about what you made, how it's tasting. So the key is just kind of these small, sustainable kind of changes over time.
And how does socioeconomic status fit into, brain health, mental illness, brain function?
Yeah, so SES really impacts somebody's ability to manage chronic conditions, because really the more resources you have, the more access to care you have, the easier those things like hypertension, diabetes, high cholesterol are to manage, and the healthier your brain might be. So if you think about neighborhoods with less resources, those folks might have less access to grocery stores with kind of quality, healthy foods, or restaurant options that are more than just fast food. Might not have good insurance, might have a long distance to travel to get access to a hospital system, particularly in rural communities. So SES really affects management of cardiovascular issues, chronic conditions, and that in turn affects brain health. So, unfortunately, racial and ethnic minorities are more susceptible to developing dementia, and I think that's because there's an association there with more at risk for having lower SES status.
Okay, we've had a really fantastic panel, so I'm going to do something that I always like to do, which is have a quick lightning round and come back to each of you in the same order that you went and ask you just to make one final statement, bit of advice, a thought to leave our audience with, so that they can, take all of this and just live a better life. So, Andrew Blake, we're going to start with you.
Hey, thanks, Kevin. So like I said, it's very important that you consider going ahead and getting your flu shot to not only protect yourself, but those around you. I know it's a little scary to get out there and get back into public again, but Kroger's doing everything that we possibly can to make sure that we have a safe environment for you to come into. I also recommend that you take advantage of our appointment system. If you go to kroger.com/flu, you'll be able to choose your pharmacy and schedule an appointment time so you can come see us and get that taken care of for you.
Thank you, Andrew. Dr. Hines.
Thank you again, Kevin. And my words would be to try to control the things that you can. There's so many things out there right now that we can't control, but you can try to take control of how you eat, how you exercise, and getting back in to see physicians, nurse practitioners, pharmacists, those people that can provide the necessary care that you need to have even in this environment.
Thank you, Dr. Hines. Brendan.
Yes, again, thanks for having me today. I think that one thing, if we just kind of put what we all spoke about together, is staying proactive in some degree, whether it's related to getting a shot or getting your hearing tested, to make sure that you're staying in communication with others to have that proper brain function. I think it's important just to stay proactive as you continue to age and notice differences in your body.
And Dr. Bryant, you get the final word.
All right. Well, thank you very much for having me. I think a key point and what I really wanted to talk about during this time was that if you need any more incentive to take care of yourself physically and get out there, see your doctors, and stay healthy, eat well, another incentive is that it's good for your brain. It's going to keep your memory stable as it can be and kind of optimize that quality of life.
Thank you. Thank you, Dr. Bryant. In closing, we want to once again thank the sponsors who made today's program possible: Kroger, Wellstar Health System, and Georgia Relay. We'd also like to recognize the other sponsors who support the AJC's Aging in Atlanta series throughout the year. Be sure to visit ajc.com/aging for updates on senior living topics and a recorded broadcast of this event. Thanks for joining us, and we look forward to seeing you again on Wednesday, October 28th, for our next Aging in Atlanta virtual event. We believe these events are part of our mission to keep the community informed and a way for us to give back to you, our valued newspaper subscribers, who help fund our local journalism and journalists. Thank you.